Hello and welcome. My name is Dr. Nelson Lee Novick. I'm an emeritus clinical professor of dermatology at the Icahn School of Medicine at Mount Sinai in New York City, and I have a private practice devoted to cosmetic dermatology located on the Upper East Side of Manhattan. The subject of this video is part one on a two-part series devoted to the appropriate and proper use of injectables to turn back the hands of time. Before I turn to what we can do to turn back the hands of time, we need to understand a few things about what goes on in the aging process. With the passage of time, the muscles of facial expression, which is located under the fabric of the skin, but they become overactive with the passage of time. Now, concomitantly, we lose collagen and elastic fibers in the fabric of our skin, so that what happens is when after years of using these muscles to emote, to smile, to laugh, to sip through a straw, to smile very, very hard, the overactive muscles don't have the resistance from the fabric of the skin, so that it becomes like a sheet of paper that's been folded and creased, and after one creasing, you open up the paper, you can see the crease line down the line of the paper, and it remains permanently. But what happens with us is we retain these lines that when we were a child and we smiled and we laughed and we sipped through a straw, we returned right to exactly, the skin was smooth. Look at any 5-year-old child and watch them smile hard and laugh hard, and when they're finished smiling and laughing hard, the skin comes back to perfectly smooth. But for us, as we age, and we lose this resistance and this counterforce from the collagen and elastic fibers that are being lost with the passage of time, the etching remains on the skin, so that what we end up with are crow's feet at the sides of the eyes, horizontal worry lines across our forehead, deep 11 lines or frown lines between our eyes, crinkles under our eyes. These are the products of these repetitive movement 1,000 times a day of these muscles as we go through our day, and the skin just keeps etching and creasing and creasing. Here is an individual, and over time she's laughing, and you see that the laugh lines are present. Early on, she would be able to laugh, and this is more like a very young person would be able to laugh, and after finishing laughing, or smiling very, very hard, the skin would return to normal. However, with the passage of time, these dynamic wrinkling will etch the skin so that this person is no longer smiling, but yet the smile lines, the crow's feet and smile lines all around the face become etched in, so that at rest you see the wrinkles that were once only apparent when the motion of the muscles was evident. So the first step that can be completed in an office visit is to treat those overactive muscles and to get them to respond more like when a person was younger. And that we can do with neuromodulators such as Botox or Dysport or Xeomin. Please take note, we are not trying to freeze muscles with these injectable neuromodulators. We are not trying to create faces that look like porcelain dolls or kabuki dancers. The idea is we want to get the overactive muscles to be more quiet in their movement, to be more like they were when a person was younger, so that we have a very natural face. We're looking for natural, we're not looking for frozen. The objective is to allow a person to be able to emote without leaving deep creases in the skin, as well as improving, to whatever extent is possible, the creases that have already been created. In a subsequent video, I'm going to discuss the non-surgical HA filler facelift. For more information about this or any other subject of cosmetic dermatology, you can check out my website, youngerlookingwithoutsurgery.com, or drnovick.com. That's DOCTORNOVICK.com. Thank you.